Hi, my name is Patrick Waite, and I'm Senior Vice President of Patient and Health Innovations at the American Heart Association. Our focus is building healthier lives, free of cardiovascular disease and stroke. I'm very excited to be introducing the Qualia Health team to you today, who's really working on the intersections of consumer and health technologies and focusing on the challenges of blending observational and clinical data and measuring the quality of life for patients. We look forward to seeing them in the marketplace and finding ways to work with them together. Thank you.
Hi, I'm Dave Beiser, co-founder of Qualia Health, and I'm also a doctor at the University of Chicago. With healthcare reform, hospitals like mine are desperately looking for ways to improve the health of their population and at the same time decrease costs. At Qualia, we're developing a platform that monitors a patient's health in between doctor's visits to keep them healthier and out of the hospital. So what exactly does it mean to be healthy? The World Health Organization defines health as a state of complete physical, mental, and social well-being. Physical, mental, and social well-being, not merely the absence of disease and infirmity. So if we're going to keep patients healthy, we need ways to measure this. And in fact, that's what I do as a doctor. When you come to see me, I perform a physical exam. But I also ask you how you're feeling. I ask you about your symptoms. And through this process, I develop a very intuitive understanding of your overall health. And that works when you're with your doctor. But that's a very reactive model of medicine. We're now shifting to a much more proactive model of medicine, where hospitals and providers are going to be rewarded based on their ability to keep patients out of the hospital. But to do this, we need new tools. So let me introduce you to some of them. Here we are at the world's first connected devices accelerator. And this explosion of new sensors and the Internet of Things provides a wonderful opportunity for measuring the physical health of our patients on a continuous basis. But there's something missing from this health graph, right? Where is the mental health? Where is the social health? And what's the best way to measure these? That's the question that motivates what we do at Qualia. So we've developed a platform that takes information about your physical health from connected devices and combines it with information about your mental and social health. And we put it together into a single metric of your overall health called the Q-score. The Q-score is a credit score for your health, and it provides both patients and providers with a continuous measurement of health, and by doing so, improves outcomes and lowers costs for the system. So let's take a look at the Q-score from a patient's perspective. So we begin by collecting information from all the connected devices in a patient's environment. So these would be wireless blood pressure cuffs and weight scales, pedometers like Fitbit or Withings. We then have the patient spend about 1 minute a day answering 3 to 5 questions about their mental and social health. And through this brief interactive process, we're able to calculate the Q-score. But we're also able to take this information and develop very personalized insights that we can deliver back to the patient. So let me give you an example. So 2 of the things that we acquire on the Qualia platform are fatigue and activity. We measure fatigue through the questions. Then we also measure activity by counting the number of steps that you take every day. And I think most people would assume the more active we are, the less fatigue we feel. But when you look at the data that we've been collecting in patients over the last 2 months, you can see that there's no real one-size-fits-all relationship for this data. It's all over the place. It's only when you drill down to the level of the individual patient that the patterns begin to emerge. So you can see with patient 1, he follows kind of the common assumption that the more active he is, the better he feels. While patient 2, when she's more active, she actually feels worse. In patient 3, he's on the golf course, so none of this matters. So we've got 3 patients, 3 different patterns, and of course that leads to 3 different Q-scores. and also 3 different highly individualized insights into their health. And this is very useful to patients. This is personalized healthcare. It's useful to them, but it's also useful to me as a provider because we send this information to providers onto a dashboard. And then using this Q-score, I can rapidly triage my entire patient population. I know who's sick, who isn't sick. I can also then drill down on individual patients and look at the trends. And when these trends aren't going in the right direction, the platform allows me to efficiently intervene and keep the patient out of the hospital. So I'm very excited to announce today that we are going to be doing a pilot study at Northwestern Memorial Hospital in Chicago. Thank you. Northwestern is one of the top 15 hospitals in the country. And they're very excited to be working with us because these high-risk patients cost them a lot of money. So much so that hospitals like Northwestern are willing to pay up to $100 per patient per month on these types of technologies to keep patients out of the hospital. And healthcare reform is pushing this even further. So over the next 3 years, it's expected that the market for these types of solutions will grow to over $20 billion. And with our pilot data, we're going to be really well positioned to enter into this market. So at Qualia, we've got the right team to take this to market. Collectively, we have experience in clinical medicine. I've been doing this for 10 years. We also have experience in data science, medical devices, and design at companies such as Medtronic, United Health. And I want to say, as I was talking to people out front, a lot of you are wearing Fitbits and fuel bands and other devices tracking your physical health, right? This is kind of an experiment. You want to know if this will help you. Well, in 5 years, this is going to be mainstream, and all of my patients are going to be wearing these devices. And at Qualia, we're going to be here adding meaning and context to that physical data and keeping them healthier and out of the hospital. So I'm Dave Beiser. We're Qualia Health. I look forward to speaking with you afterwards. Thank you.